was referred to as health insurance reform, and the coverage debate got quite a lot of attention. But it also has quite a bit of delivery system reform, which is incredibly important, and it is also the difference between the federal statute of Massachusetts health reform. The Massachusetts health reform statute was primarily about coverage, but the key decisions about cost containment and redefining payments and moving toward quality and value rather than paying for services is something that that state is just grappling with now and having a devil of a time doing so. So, as I mentioned, now the real work begins. This bill says the secretary shall over 1,000 times. You know, it makes you wonder if Secretary Sebelius has the best job in Washington. It is going to take HHS and the IRS to implement, because IRS, remember, has to do those tax penalties if you do not purchase insurance as an individual by 2014. Estimates suggest that it's going to cost about $10 to $20 billion to implement. That's a chunk of change. But certainly we are really redefining the way that we do business. The Congressional Research Service estimates that there are about 40 significant mandatory regulations as a result of the bill. But there's going to be a whole host of other things. So we're looking at the Health and Human Services Department having to issue guidance, having to issue requests for proposals. There have already started to be workforce, commissions, panels, boards, you name it. We're rolling forward. And so, you know, I think, again, it's so nice to be out of the Beltway because you tend to have an insular view of things. But the biggest challenge, I think, and workload in terms of health reform implementation really does fall on the states and healthcare providers. And that challenge is at a particularly difficult time, given where all states throughout the country are in terms of their budget crises, and where jobs and services are certainly being cut because there's just no other options. And I will say just on that point, you know, I was saying that the morning after I rolled in, a little bit late after the health reform bill was passed, you know, after we said, did we really do this, we started maybe trying to take 2 seconds to pat ourselves on the back in terms of all the hard work that we did. And then Roberta and others from throughout the country started calling, and I thought they were going to say, hey, great work, thanks for all your help. And they said, that's great, where's that FMAP increase? And I said, wow, that gave me some perspective in terms of what you were really dealing with in terms of this state. It was about the here and now. It was about making sure that you keep your doors open in terms of Medicaid and uninsured patients.